As we approach the International Women's Day celebrations, we must address a pressing issue plaguing our society, the crisis of unintended teenage pregnancies in Kenya, which comes with gross human rights violations. A recent report by the National Syndemic Disease Control Council sounded the alarm, revealing a shocking statistic of 696 adolescent girls getting impregnated daily in 2023. These numbers are as a result of, among others, lack of access to comprehensive sexual and reproductive health services and education. Health is a shared function between the counties and the national government, and as such, both share the blame for this crisis. Moreover, parents have a responsibility under the Children's Act and the Constitution of Kenya to promote the well-being and welfare of their children. The Constitution tasks counties to promote primary and public health care services to mitigate these unintended teenage pregnancies. Separately, the national government, through the Ministry of Health, is responsible for developing guidelines and policies for provision of health care, including sexual and reproductive health. National government action, therefore, has the potential to suppress or escalate the crisis at hand. In May 2023, the Ministry of Health pulled out of a major regional commitment that would have mitigated the unintended teenage pregnancies and reduced HIV and sexually transmitted diseases. Kenya withdrew from the Eastern and Southern Africa ministerial commitment to comprehensive sexual education. The withdrawal signals the lack of commitment by the government to protect our girls from early and unintended pregnancies and to enforce laws to stop this scourge. Resolving this crisis seems distant, especially considering the reckless remarks made by some leaders, including Bungoma Governor Kenneth Lusaka. Lusaka said pregnant girls should be barred from returning to class, undermining their rights to education and victimizing them more. Ironically, Bungoma is one of the highest contributors to teenage pregnancy with a prevalence rate of 19% at the county level compared to the national average of 15%.
And this is our position. We have looked at Kenya Demographic and Health Survey of 2022 report and came up with two categories of counties. The first one we are going to talk about is counties with high number of teenage pregnancies among the adolescents, girls aged between 15 and 19 years. And then the other category is the counties with the biggest per capita percentages. So in the first category, we are arguing that our girls cannot be reduced to statistics. For every girl counts, and a human rights violation affecting one girl is very significant. So this is our classification of the counties with high numbers in terms of nominally. The first one is Nairobi County with 452. Second, in that order, is Kakamega County with 328. Third is Bungoma County with 294. Fourth, to be recorded, is Nakuru County with 283. Fifth is Kiambu County with 267. Sixth is Kilifi County with 224. Seventh is Meru County with 206. Eighth is Kisii County with 192. Ninth is Machakos County with 178. And the last but not the least is Narok County with 176. Now we go to the second category. The second category to which we are issuing red cards are the counties with the highest per capita contribution to teenage pregnancies in Kenya. So this one we have looked at the numbers against the population. These are, number one, Samburu County, which has 50%, headed by Governor Jonathan. Number two, West Pokot County with 36.3%, headed by Governor Simon Kachapin. Third is Marsabit County, which has 29.4%, headed by Governor Mohammed Ali. Fourth is Migori County, which is at 23%, headed by Governor Ochilo Ayako. Fifth, in this second category with per capita numbers, is Kajiado County, which is 21.8%, headed by Governor Joseph Ole Lengu. Sixth is Baringo County, which has 20.3%, headed by Governor Benjamin Chesire Chavoy. Seventh is Siaya County, which is at 20.9%, headed by Governor James Orengo. Number 8 is Taita Taveta County, 18%, under Governor Andrew Madime. Ninth is Trans Nzoia County with 17.8%, headed by Governor George Natembeya. And the last is Isiolo County, which is at 16.7%, headed by Governor Abdi Ibrahim Hassan.
This information was analyzed from the Kenya Demographic Health Survey, and according to the report, some of the causes of these pregnancies include poverty, sexual gender-based violence, low levels of education, harmful cultural practices, and from other studies, the extended school closures experienced since 2020, that's during COVID-19. Consequently, a number of human rights violations are experienced by our girls aged 15 to 19 years. Some of these rights that are violated include the right to education, where we are saying the girls form a large percentage of school dropouts, the right to life and dignity, teenage pregnancies contribute to life-threatening conditions, the right to health, they face barriers in accessing sexual and reproductive health services, which is against Article 43 of the Constitution of Kenya, the right to equality and freedom from discrimination, and we are saying many of these girls are exposed to stigma and other forms of discrimination, the right to freedom and security of the person owing to the exposure to sexual and gender-based violence faced by the girls. Overall, the above consequences amount to a violation of Article 53, 1D of the Constitution, which provides that every child has a right to be protected from abuse, neglect, harmful cultural practices, all forms of violence, inhumane treatment, and punishment, among others. Resultantly, KHRC is today issuing red cards to the following governors and a cabinet secretary for not making tangible and progressive steps to mitigate these unintended teenage pregnancies. So we are red carding 10 governors. Number 1 or top on the list is Nairobi's Johnson Sakaja. Number 2, Bungoma's Kenneth Lusaka. Number 3, Kakamega's Ferdinand Barasa. Number 4, Nakuru's Susan Kihika. Number 5, Machakos Wavinya Ndeti. Number 6, Kiambu's Kimani Wamatanyi. Number 7 is Kilifi's Gideon Mungaro. Number 8, Meru's Kawera Mwangaza. Number 9, Kissis Simba Arati. And number 10, Narok's Patrick Ole Ntutu. And finally, at number 11 is the Health CS Susan Nahumicha.
The above 10 counties, the above 10 governors who have been red carded are the 10 counties which, according to the survey, are leading with high teenage pregnancies. And so the above have been red carded for the aforementioned teenage pregnancies, which could have been prevented had the governors and the CS implemented proactive strategies to address them per the county mandate. Additionally, Kenya's withdrawal from the Eastern and the Southern Africa ministerial commitment to comprehensive sexual education and other critical policies could have contributed to these pregnancies. Importantly, we call on the following to take decisive actions towards mitigating unintended teenage pregnancies. 1. The Ministry of Health must recommit to the Eastern and Southern African commitment on comprehensive sexual education. The Ministry for Education must also ensure that every teenage girl who falls pregnant is unconditionally permitted back to school and provided with the necessary psychosocial support without discrimination. Governor Kenneth Lusaka must retract his statement against schoolgirls who fall pregnant and commit to facilitating their decision. The Council of Governors should interrogate the crisis as a matter of urgency and offer a collective voice on policy issues affecting the prevention and the management of teenage pregnancies in Kenya. Parents must, in line with the Children's Act and the Constitution of Kenya, promote the well-being and the welfare of their children.